Hi, I'm Becca Kennedy,
Hi, and I'm Howard Schubiner,
and this is The Science Behind the Symptoms, where we explore the new science of neuroplasticity through a lens of curiosity.
and we are coming to you as a podcast from the Association for the Treatment of Neuroplastic Symptoms, our nonprofit.
And today we are very excited. We have a guest, Liz Coten, and we are going to talk about long COVID. This is something that is very common right now. Absolutely. Something in our world comes up a lot. So we're going to talk about Liz's experience with long COVID herself. And Howard and I are going to explore, again, through curiosity, the science behind it. So with that, welcome, Liz. And
Thank you.
I'm going to invite you to talk about your experience with all of that.
Sure. So my experience with long COVID started with COVID. I uh, got COVID right at the start of the pandemic in March 2020. It was a little bit of a freak thing. My kids brought it home from preschool. Like many people who experienced COVID, it was pretty unpredictable. My husband was mildly sick, I mean, barely sick, and I was very ill. I was very sick with COVID, and the kind of what I would say was like the acute period of being sick lasted for quite a while. But then after about, 2 months or so, I felt like I had sort of turned the corner in, kind of this acute period of being sick, but I just wasn't getting better. And I felt like my body just wasn't recovering, and I kept thinking to myself, this was, of course, very early on in the pandemic. So what was known about COVID was very little. I worked in media and journalism, so I had a pretty high level of understanding of what was known, but there was just so much that wasn't known. And, I at first I thought to myself, well, this is a new disease. Maybe it just takes longer to recover. I've been pretty ill, but I really couldn't do much of anything. Was extremely fatigued. Doing the what I consider to be small things would leave me exhausted. I would try to Zoom with friends, and after 30 minutes of talking, I would be exhausted. Um, I tried to kind of go for a walk, and I would feel tired for a day after. Um, I had very low energy, and I had symptoms that were kind of pervasive throughout my body. I had chest pain and palpitations, a very high heart rate. I went to the hospital twice because they were concerned about how high my heart rate was and the pressure in my chest. But all my tests looked normal. That was, they kind of sent me off, and I was like, are you sure it's okay for me to leave here? And they were like, we wouldn't let you go if you weren't okay, but I didn't feel okay. And I had,
Pain, that can feel scary
it
when it's
was terrifying.
you and you have chest pain
Yeah,
and they're also not telling you why you're having the symptoms.
no,
That can be really
yeah. And I think against the backdrop of, we didn't know very much. And so they couldn't tell me why I was having the symptoms. And, there was just so many unknowns. And so it left a lot of room for uncertainty. And within that too, a lot of speculation, well-meaning people who were sending me information of, is this the new HIV? And, is this a disease that you contract and it wreaks havoc on your system, for a prolonged period of time. Um,
And these were
I
things that were different from the acute phase when you had acute COVID from the first weeks or month or so. Were these like completely different symptoms than were some of the symptoms of acute COVID had gone by then, or were they all
Yeah, I
continuing?
would say I would say some of them had gone, but some of them kind of felt like they were lingering in this more kind of like permanent state. I had terrible insomnia. I would wake up every night. I was so exhausted, but I would wake up every night as if I was having a panic attack where my heart was racing. I was on alert. It was like my body or my brain would not let me rest. It was kind of, I was, the chest pain was very scary. you're taught to kind of feel like that's an emergency. And so, just being on alert all of the time. And, I I felt like I didn't have the strength I had before. I didn't have the capacity I had before. I felt very cloudy in my thinking. That was one of the scariest things to me, was like the brain fog. I would find myself doing things that I couldn't believe I was doing. I would write something, but I would transpose the words and, mix things up. Um and I felt like I couldn't think clearly. And, I had a lot of headaches and dizziness, and it just, felt really worrisome, like what's happening to my body. Um,
And that is
it,
worrisome. I mean, that is
yeah,
very worrisome. To have all of those symptoms, that's so overwhelming. Sounds like you probably couldn't live your life in the normal way. You didn't have
yeah,
answers, didn't know what direction you were going.
yeah,
And to happen all at once, right? To happen all at
yeah,
once. All these
yeah,
things going wrong at the same time.
at
They're
the
just
same time.
piling on each other. It's like you contracted the worst disease in the world, and
Yeah,
nobody
yes.
knows what it is.
And no one knew what it was. And it was very stressful time for everyone. I mean, I was at home on lockdown. I had a 1-year old and a 4-year old
Oh.
at home, and trying to be strong for them and do what I could, and also support my husband. I felt it's so difficult to be sick like that and still try to be a parent or a partner, or I was
I mean, it's
so
difficult to be a parent and a partner in the best of health, but
yes,
when you're not feeling well in your body and there's this external stress going on and all of these other things, and that's hard.
In
yeah,
the midst of a pandemic,
in the
right?
Yeah.
midst of a pandemic where
Well,
everyone is,
yeah.
hyper vigilant and on alert and on edge. And my symptoms were severe enough that I had to take a leave of absence from my job. And I took 2 months to see if I could recover. And, I then went back to work, but I worked from bed and, did what I
Wow.
can. And at the time, I was just trying to find answers. You know, I just, I'm a very kind of information seeking person, and I wanted to know what was going on. And, I wanted to understand. And there was just only so much to be understood. And, you know, I unfortunately had the experience, as I think a lot of people do, with well-meaning healthcare providers who didn't really know how to engage, and so I was told, this is an anxiety issue. You need more anxiety medication. So I took anxiety medication, and I actually felt it made me feel much worse.
Mm,
you
interesting.
know, I, um, I went to a cardiologist, and he had me do a stress test, and it put me in bed for a week. And, there was a lot of, he told me, I'm not even sure you had COVID. I don't know if this is what's going on with you. Maybe this is some other virus. This is something else. And so there was just a lot of, kind of what felt like gaslighting of what the experience was, and at the same time, not a lot of help.
Mhm.
And so, over the next couple years, I really kind of tried everything to recover. I went to the long COVID clinic at Cedar Sinai here in Los Angeles. And I saw a bunch of different doctors, specialists. I was diagnosed with POTS. I saw a doctor who specialized in POTS. Um, and I tried all kinds of medications, treatments. At one point, I think I was taking like 12 different medications a
Wow.
day.
Oh,
And some of these medications were pretty intense. The side effects of them were pretty intense.
What were some of the medicines that you were
yeah.
taking?
I took steroids, I took beta blockers, I took a statin at one point. I took uh medication for naltrexone medication that is sometimes given for
Uh,
inflammation in
Blood
chronic
dose.
fatigue.
Low dose.
yeah.
Yeah, low dose naltrexone. Um, all kinds of supplements, medications that were used, some medications that were used in HIV. There were
Wow.
there were a lot of kind of experimental treatments that were going on at the time, and I did other things too. I did, acupuncture, massage, cranial sacral therapy, and I found that, like, some things like the acupuncture, the cranial sacral, like I actually would feel better for like a period of time. I did IV treatments where I got these high dose vitamins and I would feel better for a day or two, but then it kind of would reset.
And did medicines help, at least temporarily?
Yeah, I think some of them did help temporarily. I mean, I felt better when I took steroids, but I think most people feel better when they are on steroids, and some of the things, I felt like there was a little bit of a lift, but I just didn't feel like I was addressing the root of what was going on. I kept trying to figure out, like, what is the root of what is happening here systemically? These symptoms are happening all over my body. I felt like I had cardiovascular symptoms and neurological symptoms and dysautonomia, sort of like all of my body's functionality, not working the way it should. I kept thinking there needs to be one kind of unifying reason why this is happening.
And let's stop for a second because that's exactly right. Is that's what we're taught in medicine is to look for a unifying diagnosis because most of the time when there's lots of different symptoms happening at the same time, instead of diagnosing all these different reasons for different symptoms, just the way things work, it's more likely that there's one reason to explain all of them. Pattern that we really look at in medicine overall.
And nobody could tell you that. I mean, was the message you were getting was you were going to recover? Was the message you were getting you were not going to recover? I mean, you're talking about 2 years at least. This is a long time to suffer.
It was a long time. It was incredibly difficult. The messages that I were getting were just filled with uncertainty. I also just got a lot of alarming messages too. I had some doctors who ran tests on me, to see my cytokine levels or how much, neurovascular inflammation. And I would get these kind of alarming reports of like,
Yeah.
these are very high. This is, but yet there wasn't a lot of information about what that meant. It was just, this is really high and this, um,
So
you
you had
know,
this test that came back abnormal, like
yes,
cytokines or abnormal.
normal cytokines, the microscopic, like kind of blood clots,
You had a
um,
test for that.
yes, I had some testing for that. And, it's measuring inflammation.
And what
Um,
did they do? Did they treat you at all for these abnormal tests specifically?
I mean, I think the goal of some of the medications I was on was to treat me for some of those things and to treat me for the symptoms, but there wasn't a lot of optimism for recovery. There was also a lot of panic around reinfection. So that
Yeah.
was very difficult for me because I had to make the decision about whether to send my kids back to school during the pandemic, how much to engage in the world, like how, there was all of the messages that it got was this would be devastating if you were to
Yeah.
get COVID again.
Mhm.
That was terrifying to me. And to figure out how to live life that way was very hard. And, I remember talking to a person. I was working with a doctor on, like, kind of a specific course of treatment. And a lot of these things were not covered by insurance, either. That's the thing. I think a lot of times when you're struggling with some of these conditions, a lot of the cost of them is quite high.
Yeah.
And this treatment was, a lot of money. And I wanted to talk to another, somebody else who had been through it to see what, did he feel like it was helping him? Did he feel better? And I remember him saying to me, I feel 70% better. I don't think I'll ever recover fully.
Mm.
And he was happy to feel 70% better. He did like construction and contracting in New Jersey. He was very New Jersey, very nice guy. And I think, he was able to sort of get back to what was like a physical job. But it just stayed with me at that idea of like, this is the best I can hope for, is to feel like somewhat better.
Yeah.
And that was sort of where I was at. It was like some things would improve, but I never felt like I was getting myself back. And I started to feel like I was just living this other version of my life where
Oh,
I could see the me before, and this was just a much smaller kind of version of me. And I think after trying so many things, I just kind of started to feel like, is this it? Is this just and that was devastating to me. I had overcome a lot of things in my life, especially medically. And so to sort of feel like this was the thing that was going to shape the rest of my life
yeah.
and the rest of my kids' life. I mean, they were so young that, like, to not be the kind of parent I wanted to be was just really devastating.
And were you in pretty good health prior to this?
Yeah, yeah, prior to it, I mean, I was like, a working parent, small kids who were bringing things home from school and all of that, but yes, I mean, I was in good health and super active,
Yeah.
and, um, in good shape, healthy, and, it was definitely like such a such a change from all of that.
And what did you think about through all of this? What were you thinking about was underlying going on in your body?
Um, you know I think that one thing that was really difficult for me was that because people had such different experiences with COVID, like I said, my husband was mildly sick, and I was so ill. And then I went on to have this experience. There was just this part of me that felt like something was wrong with me. There
Mm,
was something fundamentally wrong with my body.
mm,
And I didn't know what that was, but I felt like there was something underneath that was just not able to withstand this, and
mm.
that was fundamentally damaged and not strong enough, not healthy enough, not robust enough. And so, I felt like it was that, and I also felt like this disease has done some kind of damage that my body can't recover from, and that was kind of what I thought was that, you know, it had fundamentally kind of altered my body in a way that I couldn't get back
And that
to where
is
I was.
so intuitive, right? I mean, that makes sense when we think about our biomedical model is that when you have some sort of insult to your body, an injury, an infection, and the symptoms are going on, if all we understand is that the symptoms come about because of some sort of damage in our body, then that makes perfect intuitive sense. Absolutely. Especially with symptoms that are so profound and last
Yeah,
so long.
And Liz, you were getting like the best medical care possible. I mean, the best medical, biomedical care possible. You're getting all these different kinds. You had access to different kinds of doctors. You could afford, apparently, to have special testing and alternative treatments, et cetera, et
yeah,
cetera. You really did everything, and you had everything that both biomedical medicine and alternative medicine has to offer. And there were no answers,
yeah.
obviously.
No, there's no answers. And so my sister she was in this writing group that she was in with people from all over. And there was someone in the group um, who was writing about his experiences recovering from long COVID. And
Mm,
so this was a couple years into me struggling with this, and I had tried all these things, like we were just saying. And he was writing about his journey, his experience as a someone who had fully recovered. And so
Yeah.
my sister, she didn't know him really, he was kind of just in this larger group she was in, and she kind of tracked him down and she said, "What did you do? Like, how did you recover?
yeah.
Because my sister needs help." he was incredibly kind, and he said, "Just give her my information, I will talk to her." So I spent 2 hours on the phone with him one day. His story was remarkably similar to mine. He had gotten sick right at the beginning of COVID, and had gone through all of these things trying to recover. I mean, he'd go through stretches where he thought it was getting better only for it to get worse, and had kind of, given up hope. And then someone told him about mind body recovery, and it struck a chord for him. And so he told me how he had kind of started to explore this path to healing. And, as he was talking about it, it made so much sense to me. He was telling me his story about how, sometimes when, you know, his stress levels were low and he was distracted by something, he would notice he felt better. And other times, he would feel much worse. And he kind of was describing the type of person that he was and the experiences that he had, and, how he felt like that factored into what his experience were.
How would you describe that
Yeah.
type of person?
Um, I mean, he was an extreme, very caring, very sensitive, very attuned to other people. He was, um, a film editor. He is and so he was very detail oriented and kind of perfectionistic, and
Right.
people pleasing, and just kind of highly aware of others, hyper attuned to others. Hard worker. Somebody who wanted to kind of I think do things right, and uh do right by others. And, I think just the way, like, he felt like he nervous system worked was just, being more highly attuned, being more sensitive. And, you know, he said that at the point that he decided to try this, he was like, I didn't really there was no reason not to. Like, I didn't have anything to lose.
Mm.
I had tried all these other things. Um, and, and as we were talking about it, the thing was, he didn't really have to convince me, because a lot of what he said were things that I knew to be true from my own experience.
Mhm.
There were times where, I was really like focused on something else and I noticed I felt better. And there were other times, conversely, where things were very stressful and I felt significantly worse.
Mm.
And I also just know myself and my own experience. And I knew the circumstances in which I had gotten sick in the first place. My job at the time, like I said, I worked in media. My job at the time was that day in and day out from like February of 2020 on, I was reading and reviewing stories from people all over the world who were sick with COVID. And so I was hearing first person accounts of people who were getting sick, describing their symptoms, describing their terror. I am an extremely sensitive person. There's not a someone's story, like, it's hard for that not to become something I feel intimately, especially these kind of accounts that were so raw. And so I knew that my sensitivity, my stress level, from my job, from my own personal experience, like, was very high going into it. My worry and my terror,
And
you
just
know,
seeing your brain day in and day out,
day in, day out. Yeah.
that's really stressful for your brain.
Yeah. It was very stressful. And, you know, I have my own personal history with trauma and medical trauma. I had leukemia as a child. And so the idea of a major, kind of catastrophic medical event is still very close to me. And so, what happened to me when I got COVID and then long COVID was almost like time collapsed, and the childhood event started to kind of bleed into be me as an adult. And
Yeah.
it was almost like I could not distinguish the two of those things
Mhm,
from one another.
mhm.
And so, all of the all of that terror, all of those things that as an adult, I just didn't really engage with. I felt like it was in the past.
Mhm.
Suddenly, all those feelings came flooding out. And so
And
once
isn't
I
that
start,
interesting? I mean, that because that's how our brain works. That's the predictive power of our brain is our brain is always searching for danger and it's storing, remembering everything that happened that was dangerous that we went through. And then it uses that information to then apply to the current moment to make meaning of the moment. What our brain cares about is protecting us and keeping us safe. So if there's something really dangerous that you went through with the leukemia in your past, that is going to be restored very strongly in your brain. And then your brain's going to bring that information and actually create your experience partly based on what you had gone through.
And probably in a couple different ways. One way it does that is by making one tired, to
yeah,
stay in bed, to rest, to withdraw from the world, to recover and recuperate.
Yeah.
It's a very powerful reaction and a brain's way of protecting us. And the other way it was probably protecting you has to do with the fear.
yeah,
Because it remembered obviously all the fear that happened to a young child having leukemia, going through chemotherapy, and all the amazing and horrible things that go on without, at that age, without having the wherewithal to really understand it and cope with it that well. And so, your whole autonomic nervous system was kind of on edge, on fire, right? You
yeah,
described the rapid heart rate and the panic attacks in the middle of the night, not being able to sleep.
Mhm.
So this combination of, kind of panic and fear on one hand that the brain creates, you can see why it would do that. And
yeah,
this other combination of withdrawing and not being able to engage. It's amazing.
yeah, yeah. And I will say that just on like, yeah, I mean, it was so interesting. I think exactly as you described it was like I had this sense that my brain and like was channeling feelings or experiences from a long time ago. Like
Mhm.
it just felt like, sort of like these were these like sort of survival
Mhm.
tactics from like much longer ago. And, you know, what I think is, this is probably a somewhat common experience to people who are dealing with chronic pain or symptoms, but like the one thing that being so sick like this did like sort of give me permission to do was to take care of myself
Mm.
and to
Mhm.
like have some boundaries and to think about what cuz I couldn't, it was like my job was to sort of like take care of myself, get through the day, try to take care of my kids, and that was kind of the max of what I could do. And so, I think in a way sometimes these things also kind of point the way towards what's not working and,
Mm.
you know, where these things are, where your system is kind of saying, it's too much.
Yeah,
But
those people please
yeah.
personality traits that I certainly have myself. And then sometimes, being a woman in the world and a mother and
Mhm.
working and all of these obligations and wanting to stand up and, do your duty and contribute and be nice to people and all of that
Mhm.
is so common, like you're saying, that then our own needs get put on the back burner and then
Yeah.
really get out of sync.
And your job was particularly toxic,
Yeah.
given all that Becca was talking about on top of it, the amount of work you were doing, plus the kind of work you were doing, in terms of all the stories. And it was bad enough just reading the newspaper at that time, but
Yeah.
you were super engaged in those stories. It just sounds like a perfect storm, really.
Yeah, and
Yeah.
that's kinda what I came to realize as I started to learn more about, what do we mean by mind body medicine and what do we, and it was just the more I learned, the more fascinated I was, I wanted to learn more and more, I wanted to better understand it, and it felt like, not only did it start to explain what was happening in my body, but it also started to explain what was happening in my life
Mm.
Mhm.
too. And, I wanted to better understand all of that and, kind of dug in where I could and got help where I could from Becca, one of the key people who was so helpful in my recovery, and from Curable, which I used daily as sort of like the how to do this work. And it just all of these pieces of my life that I felt like were kind of these disparate pieces suddenly started to have more context, and like I fit together and understood it. And I think one of the early gifts of this work to me was to basically be told you're okay. Like you are okay. Like there's not something defective or wrong with me. Your body is healthy and strong. And yes, like things may come up, but the idea that actually like there wasn't something fundamentally wrong with me or flawed, and that, I had just spent so long feeling that way, and that idea that,
Mhm.
the body has this capacity to recover, and, you know, uh, thinking about what role our brain plays in that, and that because of the role our brain plays in it, because our brain can help us heal, can create these new neural pathways all of the time that can help us heal. Like there's so much power and possibility for recovery, and that
Mhm.
just was such a different message than I had ever received
Yeah.
before,
And
and that was really life-changing.
that message of you're okay, how did you get that message and why did you believe it?
I mean, I think that 2 things. I think that I one of the things that I really appreciate about both of you is that you're grounded in the science. And, I think working with Becca, I she could probably say, I asked a lot of questions. And so I wanted to, because, there are a lot of, and I'm sure you'll talk a little bit more about this, but there are a lot of theories about long COVID, about what's causing long COVID. Obviously, there's a large segment of the medical community who's been trying to figure out like what is happening with this. And so, I had been told, over the years that I was struggling with this, that you know there's all these theories for what's going on. Is it viral remnants? Is it these blood clots? Is it the cytokines? Is it inflammation? And so having the scientific kind of understanding or explanation of what these things are and how they actually can be pretty easily understood responses in the body that are not indicative of like disease or dysfunction, or structural problem. That was really helpful for me to understand that, like, I want to kind of make sure that like I understand like the reasoning for things.
Mhm.
um but some of it was just an emotional thing too, whereas like, what if I had permission to not think of myself this way? Then what possibility might there be for me to live life differently if I wasn't, worried about what all this meant? Like,
Mhm.
and I could think of myself as like somebody who could be healthy, and that just felt really freeing.
Yeah. Amazing. Yeah, and that can be a challenge, absolutely, when you're having such overwhelming physical symptoms to think about that your body is actually okay, in that the generator of the symptoms is not happening because of some sort of damage or problem in the body, but more it's the other way around, that the brain is giving the body all these symptoms, I mean, all these messages that then is creating the symptoms and can be creating biochemical changes as well. I mean, that's how our brain works and our body works. But thinking about what the root of the problem is that it's the brain, the fear, the nervous systems being stuck in that state rather than damage.
And kind of understanding that in a way that's not dismissive
Right.
or judgmental or gaslighting. I mean,
Yeah.
that's a fine line, don't you think?
Yeah. I think it is a fine line. I remember someone, Becca, when I was doing the long COVID class with you, and somebody in the class said, I feel kind of bad and kind of silly to think that, a lot of this was in my head.
Mhm.
And I remember, like, it just struck a chord with me, and I remember replying to this person and saying, "This is nothing you've done wrong. Um, this is not you. You're not creating these symptoms. You didn't, this is,
Want them.
yeah, you don't want them. This is your brain. This is a way your brain is working. And, where I feel like the real failing is the fact that um, this message isn't given to more people more readily. If we better understood or, could share with people that this is, this is how the brain sometimes works. And the genesis of, a lot of our pain and symptoms comes from the brain. I think it would be understood as, a physical and an emotional reality for people, um, that doesn't feel like, oh, it's something that I'm making up. This is, something that's in my head.
Mhm.
Um, we just I think in our, kind of medical model, we don't really talk a lot about the person as a whole. And so, the idea that the brain and the body are connected and that our physical and emotional experiences are processed by the brain in the
Yep.
same way, we don't think about that. We think about, I have a pain in my knee and it's my knee that's the problem,
Yeah.
you know?
Oh,
Yeah.
absolutely. It's like you're both talking about, it's a fine balance that this is not your fault. These are learned neural circuits because of what our brain has gone through, because we're a human, because we have a bias for danger to keep us alive on this planet. And when those neural circuits are practiced over and over and over, they're the default mode and they're reflexive. And so understanding that they're there because we're a human and because we've gone through what we've gone through, and that's why we don't have to blame ourselves or feel bad about it. And we have full compassion and love and understanding that there is huge, huge, huge suffering from these neural circuits. And also, there are these tools that are all counterintuitive from my perspective that people can use themselves to get better. And there's absolutely no reason that someone should know what the tools are on their own. There's
Yeah.
no reason that they would know.
And how not to have compassion for somebody who's been through childhood leukemia. How not to have compassion for somebody who's living in the midst of a pandemic with small kids and and working in a difficult and one might even say toxic environment, and somebody whose beauty lies in their caring for others and sensitivity for others. But when you put all that together, your brain is starting to signal this is dangerous.
Mhm,
This is
mhm.
not good. And then you get an infection on top of it, and the infection causes you to be really sick for quite a
Yeah.
while.
Mhm.
I mean, that's a tipping point,
Yeah,
and it's no
Yeah.
wonder.
right.
Well, of course, this is going to happen. It's
Mhm.
not a question of you being defective. It's
Yeah.
a
Yeah.
question of seeing yourself as a whole human being.
Yeah. Absolutely.
People ask me that a lot. They say then, "Well, why COVID?" Then why did COVID itself
Right.
cause this if there isn't anything about the actual virus itself, like the spike proteins, or that this virus is different than other viruses that cause some other damage in the body. But I think you really talked about all of this beautifully, is that it's sort of setting the stage of these prior stressors and history to sort of prime the brain for danger, and then the actual infection can be what then tips it over. It's that added stressor. I mean, it's stressful to just be sick in and of itself, with even just a normal viral infection. And so when our brain is just kind of up here in hypervigilance, and then with the pandemic and all those things, then the viral infection itself then is what tips our brain sort of over the top of bringing it into this constant state of
So
hypervigilance.
maybe we should talk about the virus a little bit, huh,
Yeah.
Becca?
Mhm.
Yeah, right. Yeah.
Right. I mean, it's interesting because for most of the people who got long COVID, they did have a typical viral infection. Now, COVID wasn't a typical virus by any stretch of the imagination, right? Which people died. 1 million people died in the United States, 7 million people worldwide. I mean, this is a major, major upheaval in our world, in our lifetime. But on the other hand, 90% of the people with long COVID had mild or relatively mild viral infections. And so that's one of the pieces of science that I think is important for us to know.
Right. So if we think about, how does this make sense? How does the science make sense that the reason that people have long COVID symptoms is because of the brain's hypervigilance sending signals through the nervous system to the body rather than being due to something in the virus or damage in the body? Just like Howard said, most of the people who have long COVID actually had mild infections. It's a very small number of people who had very, very severe infections that were hospitalized that are actually the ones that developed long COVID. Also, people who are elderly and quite sick and frail, just in general, are also not the demographic of people who have long COVID. It's actually more often the demographic of you or me or
Mhm.
a middle-aged woman, frankly,
Mhm.
who's otherwise healthy, is more likely to have long COVID than people that have underlying bad medical problems.
And in the French study, they had serologies on 20,000 or so people, serology antibody testing for who had COVID and who didn't have COVID. And people who didn't have COVID by antibody testing, it's a little controversial, but I think it's relatively clear to say that most of the people with negative antibody testing on their blood didn't have COVID. And the similar percentage of people who had negative testing as who had positive testing actually developed long COVID. And this makes people mad. It's because they're saying like, oh, you mean I didn't really, I never had COVID. It's not a question of that. And there's other study, the Klaus study, that showed a similar thing where people who were followed after routine health visit and other people who were followed after influenza infection, different virus, and other people who were followed after acute COVID virus infection. Those three categories of people had similar rates of long COVID development. And so it appears to be true that it's not actually something that's really specific or scary or damaging about this virus.
And that study that you just said, Howard, the Claus study of Bergman et al. From University of Michigan, that was looking at 3 million patient charts, and the rates of getting long COVID after having those chronic overlapping pain conditions was increased by 40 to 50% in all of those different categories. And when I was the lead of the long COVID clinic at Kaiser Permanente, it was just me and a small group of physicians that reviewed all of the patients in our 500,000 patients, all the patients that were referred for with long COVID. Is very early on in the pandemic, many of the patients said to me, "Oh, I got these symptoms after I had a COVID infection like you did." But other patients said to me themselves without me asking, "Oh, well, I never had COVID. I just had the vaccine," and they got the symptoms after the vaccine. But then other patients said to me, "Oh, I neither had COVID nor the vaccine. And these are the same symptoms that I had prior to the pandemic even starting, but the symptoms are worse. And they're the same symptoms of long COVID, this pattern of long COVID." And this was way back when actually people actually hadn't had COVID necessarily. And so even as a clinician, I saw quickly that you didn't actually have to have had the COVID infection in order to get long COVID. And again, it's not invalidating the symptoms or the terrible, terrible experience that many people go through, but I think it's better described as more of like a post-pandemic syndrome. And there's also studies of other flu pandemics, like the Russian flu in the 1800s and the Spanish flu in the early 90s, that they report worldwide. People have these post-viral chronic conditions that continue, and that's with influenza, not with COVID. And so again, looking at all the data, it really makes more sense that this is about the brain and the nervous system and the hypervigilance and the connection between what the brain says to the nervous system and the body to do.
And also the connection between, as you pointed out in the Bergman and Klaus study, that people who had prior histories of other, what we would typically call neuroplastic symptoms, such as POTS, such as fibromyalgia, such as migraine, such as autonomic nervous system, irritable bowel syndrome.
Mhm.
People who had those were at higher risk of developing long COVID, and people who have long COVID also have higher risk of being diagnosed with those other things, as Liz was diagnosed
Mhm.
with POTS, postural orthostatic tachycardia syndrome, having to do with the autonomic nervous system being kind of not
Hypervigilant.
right.
Mhm.
Exactly.
Yeah.
Hypervigilant. And the other things that lead to the other risk factors for long COVID were people with prior histories of anxiety and depression and loneliness, and people with histories of childhood trauma.
Mhm.
And Liz, we don't know about your child. We know leukemia is childhood trauma, that's for sure. But, there may have been other things. So we talked about how the brain can be sensitized by early life situations. Traumatic events could be very, major trauma, but oftentimes there are smaller traumas having to do with neglect or abandonment or not being seen or heard, feeling like they have to take care of others,
Mhm.
those kind of things. And so when you put all that together, you're really getting a bigger view and a more comprehensive and cogent view of a person
Mhm.
with this as opposed to a disease striking somebody.
Mhm.
And some of the studies that have been done about what you were saying, Howard, are very large studies. A couple 100,000 people is what they looked at in studies that have a history of anxiety and depression or PTSD as having a significant increase in the risk of developing long COVID. So many of the studies that are very, very big studies are really consistent with showing that it makes sense that it's the brain and the nervous system that's the root of the problem rather than
Right.
structural damage.
And then when you examine people, as Liz had a lot of good doctors, good examinations, when you examine people in the study published in the Annals of Internal Medicine, where they had 120 or 130 some people with COVID, and they did full testing, physical exams, EKGs, histories, all the blood tests, all the immune markers, all the autonomic system markers, and they compared that to a control population of people who didn't have long COVID. They actually didn't find differences. They didn't find tissue damage diseases that were clearly identifiable, which can make people upset. It's like you're saying, well, are you saying there's nothing wrong with me? There's got to be something wrong. I have all these symptoms. The symptoms are obviously there. They're obviously real. The suffering is real. And the question is, where is it coming from? So this study, I think, is a really important one to understand that as with Liz, they couldn't say, like you go to the hospital and you say, well, my heart's, pounding out of my chest. And they're saying, well, your heart looks normal, right? So
Mhm.
how to square that. And then what about all these abnormalities that Liz was talking about? The cytokines, the
Mhm.
immune system abnormalities, the microclots, the
Yeah,
brain inflammation. There's a lot of, there's so much data was coming out, and you can read in the
yeah.
newspapers of all these studies that showing there are some findings that appear to be abnormal. How do we reconcile that? How do we think about
Yeah, I'm
that?
wondering, Liz, before I give my 2
Mhm.
cents on
Okay.
it, but
Mhm.
Liz, what did you think about that when you started to learn this information and think about this through a mind-body lens? What were your thoughts about, well, what about, because this question comes up all the time for me from my patients. Well, what about all these studies that say that there's these structural changes like Howard was just talking about, or the ones that were even found with you?
Yeah, I mean, I think initially I wanted to really better understand that. I think that I mentioned how, I was talking to someone who had, introduced me to kind of some of the mind body stuff. And he asked me at one point, what do you think about this? And I said, I am 100% confident that this worked for you. And I'm 60% confident that this will work for me.
Yep.
Because it's really easy to feel like you're just like an N of one. You're just you, and like there's something different about you. There's something, and so I held on to that for like a long time, and I really, maybe because of my past medical history, like I wanted to, understand like there was a lot of yeah, but like, but what if there are, I've been told I have these things coming up on the test, like, what does that mean? If I do all of this, mind body work, but there's still something wrong, is it going to help me? And so that mattered a lot to me. I think that what was really helpful for me to understand is that, having a brain-based condition can trigger real physiological changes in the body. Like,
Right.
you actually, there are things, inflammation can go up, and it triggers physical sensations in the body. And so understanding that they're not dangerous or damaging, but that was really helpful to kind of help me like reconcile the two things. Like, yes, there are potentially these things that are happening in my body, but yes, also, like, this is supported by what we know about how the brain
Mhm.
works. And I think that helped me kind of reconcile those things too. And to know that, the brain can trigger these things and you can also recover
Yeah.
too.
Yeah. Yeah. Exactly. And in my looking at the research, which I've done quite a bit of with long COVID, is that, we've all heard of all these different studies that came out, the cytokines, mitochondria, micro blood clots, serotonin, inflammation, all of these different findings, biomarkers. But really, in looking at this data, is a lot of those studies are very small. Some of the studies had 11 patients or 50 patients or 100 or 150, compared to these other studies that we talked about that had hundreds of thousands of patients. So there were small studies. Some of them were of questionable scientific um, validity. They haven't been reproduced. And for instance, one of the studies by Taquet et al. On the viral particles that looked at 550 patients, so a little bit bigger, but 20% of the controls, so the people without long COVID, also had persistent viral particles. And 40% of the people with long COVID had persistent viral particles. So it was more. I mean, it was double, but it wasn't 100% of the people with long COVID. It was only 40%. And there was still 20% of the controls. So again, there's smaller studies. They haven't been reproduced. Some of them are of questionable scientific validity. And the other thing is, as you were talking about, is that many of those changes can be the biochemical changes that our brain is making through chemical signaling with our body when we're chronically stuck in a hypervigilant fight or flight sympathetic drive state. Is we know that that can increase inflammation or make mitochondrial changes. And so that can be what we call the downstream effect of the signals from our brain. And it's not those changes that are what's generating the symptoms. And that, just like you said, our body can sort itself out and it can heal when we bring our nervous system and our brain into that rest, digest, and cell repair mode.
And that correlation is not necessarily causation. So
Mhm.
that the correlation of the protein, the spike proteins, the correlation of the viral remnants, the correlation of the immune markers, the correlation of the autonomic nervous system, like heart rate variability changes, et cetera. Those are correlated with this disorder, but they're also correlated with a lot of these other disorders that are not long COVID that we talked about.
That means they both are found together, but it doesn't mean that one is causing the other one.
Mhm.
Exactly.
Yeah.
And
Yeah.
we know from Mike Danino's study that, of the 23 people he studied with long COVID, 13 of them had severe levels of post-exertional malaise that you described, Liz, where you would be on a Zoom call and then you were wiped out and you were walking around the block. You were in bed for a few days. This severe and really scary symptom of post-exertional malaise. And of the 13, who entered the study who had that, only one had it at the end. That means 12 of the 13 did not have it anymore. So they still had the changes in the biomarkers or the immune system or the autonomic, those things could still be there, but the actual symptom had gone away. And in the Oslo study also, they had really good success in helping people recover.
Hmm.
And so when we see that people can recover, without the kind of medical treatment that would affect the immune markers or the inflammation or whatever, then is again more evidence that these markers are not the cause. They may be correlated, but they're not the cause.
Yeah.
So maybe we can talk about
Yeah. And
how
actually,
you got better.
yeah, exactly. So how are you now?
What did you
Um,
do? What did you do to
what
get
did I
there as
do?
well?
Yeah,
Yeah, yeah,
what do you do? What do you do? Kind
yeah.
of, I think, um, yeah, that was, once this kind of clicked for me and I thought this makes a lot of sense. It explains a lot of things. I was like, okay, but what are the things you actually do? Like, how do you do this? Um, and
Because you started at
so,
60%,
yeah,
60% was not like,
60%.
that might not be clicky enough. I don't know.
Yeah. So, I mean, there's a lot of great books out there and resources. I read your book, Howard. I read Alan Gordon's The Way Out. Those were just, like I said, I think just transformational in terms of understanding my experience, both physically and emotionally, and the framework for all of this. I wanted to sort of have like a program that I could follow. I am a type A, obviously, type of person, and kind of diligent student. And once I really sort of accepted that this is what was happening to me, I really wanted to kind of, put a lot of effort into it. Curable was tremendously helpful for me in that because it was a program I could follow every day. I could go in to the app and it would, kind of, there's a lot of education around, the science of chronic pain and symptoms, which was, continued to be really helpful. And because I think probably there are other people like me that you need to hear this message like again and again because we're not brought up with this. Like we're not, this isn't, a lot. So continuing to have that kind of bolstering of confidence in this and yourself in this approach is really helpful. So that was helpful. And then just kind of having something I could do every day, whether it was, a meditation or expressive writing, or somatic tracking or other practices to help find greater safety and calm and start to kind of rework some of these neural pathways that were really ingrained over like, a lifetime of
Yeah.
experience
Hmm.
to for that were, kind of triggering my nervous system to respond in a certain way. And so I put time every day into doing this. And I also tried to stay patient. That was, a thing was I think I I found so much comfort in feeling like there was hope again, and um, that my body wasn't broken,
Hmm.
and that it could do this. And so, I tried to just give myself time. And, so some days were better than other days. And I would notice some symptoms would improve and other ones were harder to budge. And some days it felt like, things that got better got a little bit worse, but and that was frustrating. Like, I had moments, um, but I could tell like, it was sort of, it would occur to me, after a little bit of time, like, oh, like I could just do that thing that I wasn't able to do before. Uh, I probably noticed within the first month that, I had the capacity to do more. I used to go to, I would take my kids to like a birthday party, and I'd be standing there for 2 hours and I would feel terrible after. I mean, just, I could not do that. And then I realized like, oh, I've gone to a couple things like in the last couple of days and I'm okay. Like I'm not wiped out from it. I feel like my chest pressure is better. My heart's not racing. um, I felt like, then other things were harder. Like it took me a long time to stop having chronic headaches. And there were days where the brain fog still felt like challenging, but it was like, I could kind of see like I'm making progress. I started to sleep a little bit better. Um, I started to feel like I just had more tolerance for doing things. And that gave me kind of the confidence to keep going. Um,
And it's so important
and
to look for those positive changes
yes,
because it's so easy to forget about those and put those on the back burner and just have this hyper focus on all the symptoms that are still there and be fearing them and think, well, I'm not better yet because I have all these symptoms right here. And then forget about all those positive changes to know that you're on the right path. And that part of it is so important.
yeah. And I think like you said too, just not approaching the symptoms with the same kind of fear, or if I was afraid, to take a minute to kind of think about that. But, like we talked about, it's really scary when you feel like your heart is doing something or, it's racing or it's fluttering, you have chest pain, and to just sit with that and say, I'm okay. This is going to pass. I'm going to be okay. I'm going to get through this. And so some of it was still living with the symptoms, that, were taking a little bit longer to resolve but being able to be with them in a different way. I
Yeah.
mean, I was just so different, like to be able to relate to myself and my symptoms in that way versus do I need to go to the hospital?
Yeah.
Is something wrong with me? Is this catastrophic? um, you know,
So to,
when will this
to
happen next?
respond to to respond to the symptoms with understanding and compassion rather than fear.
Yes. Yeah, I mean, that was a huge thing. I don't think that I was very nice to my body a lot of the time, and to my symptoms. I was afraid of them and I didn't like them and I didn't want to be having them.
Which is
And I was
understandable,
worried about,
right? No one
yeah,
wants to, right? That's the
no,
intuitive. That's very intuitive.
yeah. I mean, I I am a person who's overcome a lot of things. I mean, I overcame leukemia. I had a very difficult time having both of my kids, and I got through that. As my doctor said at the time, we really squeaked through on that one. And so I've gone through a lot of tough things. And, you know, I mean, I can say this about myself, but honestly, I can say this about most people, I think, who are struggling with chronic pain and symptoms you're strong. Anyone who is dealing with symptoms
Yeah.
repeatedly in a way that's interfering with their life, you are strong. Like in whatever way you can do it, you're keeping going.
Yeah.
And so I knew that that was true and that I could keep going. And I've had this strength to and I think hope is a powerful thing. No matter what's happened to us, and how, kind of defeated we feel from it, I still wanted to have hope, and so I think being able to, you know, hope that recovery was possible and to, combine that with the strengths, the reserves that I knew I had from all the things I had gotten through in the past, that kept me going. Um, I think that, um, so many people have that capacity too. And for me, this journey was life changing. I mean, I think that it, like I said, it really, I mean, obviously it changed my life. I mean, I thought I would be sick, for who knows? I didn't know if I would recover. And, I feel, um, so different now physically and, emotionally. And, I will say that I think Howard, you mentioned this before, once I better understood this work, I did understand other things about my experience. I've had chronic migraines. I had chronic migraines all throughout my 20s, into my 30s and various other things that I now understand are, you know, embody things. And this is to some extent, probably how I'm wired a little bit, but I understand what that means and I understand, and it's not about never having days where I feel crummy or, don't have symptoms come up, but it's, how to relate to them and move through them. That is really it's been game changing for me. And I think I don't know. I think that once I started to understand this way of looking at my experience, I felt like I could just see it all around me. I could see so many people who were just suffering with various things. And, um, how much of their need is like out there for people to understand that there is this path to feeling better and living better. So, it was a very profound effect.
I mean,
Work for curable, and that's because I believe in this work so much, and I want other people to have, the opportunity for hope and recovery too, because it is possible,
But the
and
question is, do you overwork for curable?
sometimes, yes. I mean, sometimes we joke. I mean, I would say, most people who work at curable have, a history of mind body
Yes.
symptoms, and so, yes, sometimes we are wondering, like, are we doing the things that are best for us on this given day? But,
But what have you
then
learned? What have you learned about yourself that you've you know could see as life lessons maybe that
yeah,
came out of this?
yeah. I mean, I think that I I think it's so important, like, you know, um, I think that because of my early childhood experience, I wanted to just be normal, and I didn't, and to, I wanted to do things right, and I wanted to, do things the way other people wanted me to do them, and I wanted to take care of people. And, I still want to do those things. But I think that I realized, like, I just, I didn't necessarily want to think that, I needed particular things and I think that one thing I realized is that that's not true. Like, I do. I need to listen to, like, what my body and my brain and my feelings are trying to tell me. And nobody else is going to have the exact same experience. Like, I'm my own person, and, my nervous system may need its own things. And I need to pay more attention to that, and that, be more attuned to that. And I thought I was really good at feeling my feelings. And it turned out I was just really good about talking about my feelings. I could, like, talk forever about them, and to feel what I was actually experiencing and what that felt like in my body and what that was doing to my body was really life-changing. And so I tried to be really conscious of, like, how does my nervous system feel today? Like, checking in with that and making time and space for that, and not really caring whether somebody else would need to do that or not. Like, if I need to do that for me, then that's what I need to do. And to also, you know, create boundaries where I need to create them, and, um, what I can take on and what I can't. And know that, like, if there are symptoms that come up in my body, that they're a message and they're probably trying to tell me something, to try to listen to that. I used to go, you know, I would have a migraine sometimes that would last for like 7 days, and I would just be like, "Go away. I'm in a meeting. I have a presentation." Like, I just tried to shove it into, like, the closet and close the door. And
yeah.
now I realize, like, there's something going on there, and just to try to connect those parts of me better.
Yeah, amazing. It sounds like really a lot of self-compassion underneath all that.
Yeah,
Awesome.
yeah. I think that's a big part of this work.
Yeah.
I wonder if you can relate to something that just came up to me, and maybe you won't, but having leukemia as a child and then having young children and then having a pandemic going on. And I wonder about the fear of keeping them safe and the worry of them getting sick. And I wonder if that
Yeah,
was maybe a little bit part of what might have been going on.
yeah. I mean, it is very weird sometimes how life kind of, like, collides in on itself. I My daughter turned 4 at the start of the pandemic, and that was the exact same age I was when I was diagnosed with leukemia. And so I think the combination effect of, that I knew that they had COVID, so I was also very worried, like, what did that mean, very early on. They seemed fine, after, like, it seemed like it was just kind of a bad cold, but nobody knew. And then me being sick, and just being really worried about that. What was what did that mean for everyone? What was their experience? Um, I think that it's easy for the brain to kind of pull all those things together. Um,
Yeah.
and I was really worried about that. I mean, I put my younger daughter in a vaccine trial, in part because I wanted to support science, but in part because she was not eligible, the youngest
Mm.
kids didn't get the vaccine until much later. And I wanted her to go to school and I wanted her to be with her peers, but I was nervous about that. And so, she had early access to the vaccine because of that. And a lot of that was, my worry about all of that. And of course, I think it's hard to separate that from my own experience too.
Yeah.
It's really striking that you were 4 when you had leukemia and your daughter was 4
Yeah.
Yeah.
when you got long COVID. So the guy
Yeah.
you talked to originally said he was the guy from New Jersey, not that guy, but the guy from New Jersey. That was the
Yeah.
same guy, but there was a guy from New Jersey, right? Who said,
Yeah.
"Well, I'm happy I'm 70% better." Where are you now? And, you know, in terms of your recovery and how you feel and how function on a day-to-day basis.
I mean, I feel like I'm back to where I was before. I feel like, I mean, I I think I I think there was a point where I was like, I don't have long COVID anymore.
Right.
I just feel like I don't that doesn't describe my experience anymore. And I think that that's true. Uh, and there are things that come up with my body from time to time, but I don't think of them as being long COVID related,
Yeah.
and I think that they're just things that kind of come up as part of my experience of being human. And so yeah, I feel like I was able to kind of break free of being like, I have this condition. And like I said, I don't feel like, that's me anymore. And I really hope that for other people too. I really do believe recovery is possible.
Yeah. Amazing.
Um,
Awesome.
I mean, you have mind-body symptoms from time to time, Becca. I mean, Becca
I
doesn't have
do.
that.
Do
I
you,
don't have that.
Becca?
What are you talking
That's
about?
because Paris and I are not humans. Because humans
Yeah,
don't have mind
just
body
call me
systems.
Spock.
Yeah, I know. I know. When our robot overlords come, I'll be like, "What are you talking about? You'll have human feelings?"
I know. So in both of you's experience, just in the world, knowing people who've done this work in long COVID, how many people would you estimate have recovered their health wholly and completely after having long COVID? Just by estimate. Curious what you guys think.
What's the estimate in the like what the literature shows
In your
or the
experience, even.
well, I mean, the literature shows most people have recovered, maybe not fully, but most people have recovered at least to some degree. There's a lot of healing that happens even without understanding the mind-body world. People get better because their life moves on, because they fall in love, because they
Mhm.
have passion, because they get back to work. Those kind of things where they're not aware. But of the people who are doing this work, I think the recoveries are significantly higher because they fall into the category that Liz fell into, where you actually have a click moment where you really understand
Mhm.
that you're really not damaged and broken. You can break through
But do
some
you
of that
think
fear.
I think sometimes I meet people like Liz, you met one person who got better. So, and now, when I think about this, I know hundreds and hundreds of people. I mean, I've worked with hundreds of people and I know, people in America and people in Europe that are doing this work. And so, I think there's hundreds of people who have recovered through this, if not even more. So I'm just
For sure.
curious what your both of your experiences.
I mean, I think that there are many people who have recovered from long COVID. I mean, one of the biggest blessings of working at Curable is hearing people's stories of recovery.
Yeah.
I mean, I'm sure for both of you as well in your work, but so, I hear from people who have recovered, and I think, yeah, many, probably thousands of people have recovered this way. But I also think many people are still searching for answers and haven't necessarily come across this information. And so, I think there's still a lot more opportunity for healing out there.
Oh, right.
Um,
Absolutely.
but one thing that I sort of have noticed anecdotally is like Howard was saying, I feel like there are a number of people who have recovered to some degree, um, maybe for for any number of reasons. But I feel like a lot of people who have had more full recovery, it feels like have done this type of work or this approach.
Hmm.
So I'm gathering a big list from my website, and I'm going to publish it. And a lot of the people, there's about 1,000 people on the list already, and a good 20-30% of them mention long COVID as
Mm.
something
Yeah,
that they've recovered from. So
that's great.
it's
That's
pretty
great.
great to see that, and from all over the world too. What was most valuable for you? Would you say in your recovery?
I think just knowing that recovery is possible. This isn't your life, this is something that you can move forward from and live the life that you want to live. And in some cases, it might be better than the life you were living before. This isn't, I tried so many things that had so many bad side effects. And this work has very few side effects. And so, it's worth a shot. And, I just, want people to know that there's still a lot of hope.
Awesome. Amazing. Well, thanks so much, Liz, for telling your story. And we're really happy to have you on here and even happier that you have recovered as well.
Thank you. Well, thank you both. Like I said, both of you played key roles, and I appreciate all the work that you both do every day.
Yeah, glad to hear it.
I'm Howard Schubiner,
And I'm Becca Kennedy, and
and this is
the science behind the symptoms.